Good to have you on the 9 p.m. edition of the Urban Debate. The Supreme Court has ruled that centre must pay compensation to the family members of those who've died because of COVID, giving the National Disaster Management Authority, or the NDMA, 6 weeks to decide on the amount and how to go about it to frame the guidelines. Now, this is contrary to what the central government had told the Supreme Court as its view. The central government's view was, we don't have the funds to really go about giving ex-gratia to every family who's lost somebody to COVID. But the Supreme Court disagrees. And the Supreme Court has now said, frame guidelines to pay ex-gratia to the victim's kin. The national disaster body has failed to perform its duty. This is what the Supreme Court said in the hearing. Guidelines to be put in place within 6 months. The NDMA mandated to provide minimum relief. And here is the other important part that we will address. Supreme Court says that the death certificates must show the exact cause of death. So let's talk about how we will now do this. For example, what will be the amount the government finally decides? Will entire amount be borne by the centre or the state governments and the state disaster management authorities? Who is going to fund this compensation? Thirdly, how do you decide who gets this compensation? And here comes one of the biggest challenges. Because in our country, even if you see pre-COVID times, not everybody actually gets a official death certificate issued for somebody who dies in their family. It may get registered, but the certificate may never come along. Now, during the pandemic times, not everybody who's died due to COVID has gotten that written in their death certificate. As you know, there was a lot of back and forth on what can actually be said. Where can you really say COVID is the cause of death? Many of the death certificates cite comorbidities or complications that have happened because of COVID. Those complications are cited as the cause for death. In such a scenario, will that be acceptable? And the third and the biggest thing is the real mismatch in data of COVID deaths. And if you see report after report that has come in the last few weeks, looking at the overall deaths registered in 2019, 2020, and 2021, there is a huge jump that we've seen this time around. Now, obviously, that is not to say that all of these additional deaths this time are due to COVID. Some may be due to other causes as well, but some could be because of COVID. And so, because of the huge gap, there is a big concern on just how much and how many of the COVID deaths even got registered into the system. Because otherwise the people lose out on that compensation. So let's discuss this, let's debate it. I say good evening to the panelists who are joining us right now. Dr. Srinivasan Ramani, Deputy National Editor for The Hindu, joining us this evening. Mahesh Tapase of the NCP, Mr. Mahesh of the BJP Karnataka, Dhanya Rajendran, Editor for News Minute, Mr. Sarvanan, spokesperson for DMK, and Saurav Das, investigative journalist, also joining us this evening. Let's actually talk about a couple of instances of the death record mismatch, Dhanya. Various states from Kerala, Tamil Nadu, Madhya Pradesh, Uttar Pradesh, Bihar, Maharashtra. Some states are in a constant process of correcting that data, but even in those places, there is still a very big gap on what different entities show as records. Can you give us some insights into how wide this gap is in some of the states?
Well, Tanvi, the main problem is in reporting of COVID-19 deaths. Like, for example, data, Srinivas Ramani is also here. He's looked at data extensively from many states. We too have. And we have seen stories from Gujarat, Uttar Pradesh, Madhya Pradesh, for example, where the deaths are way more many times than what happened in 2019 or 18, which are pre-pandemic years. The first problem, of course, is that many deaths are not recorded as COVID-19, or the person may have got admitted to a hospital. He or she would have been in the hospital for many days, and by the time they died, the infection would have gone, they would have tested negative, and they would have died of other causes like cardiac arrest or other reasons. There are many home deaths, people dying in their houses, and families not tested for COVID-19, or they are taken for burial even before the COVID tests come in. Also, the other problem is that many states, example Kerala, and even other states, they don't record deaths as COVID-19 if there were other causes. For example, if there was cardiac arrest, or if a person had a heart disease or things like that, they often do not record the death as COVID-19. So all these factors put together, there's real undercounting happening in all states. If we look at the data of excess deaths, which is if we compare the number of deaths which happened in these states in the pre-pandemic years and in 2020 and 21, you can see that there are thousands of excess deaths which is not getting counted. And of course, in this excess death, many are because of COVID-19.
Yes, and while it would be very difficult for any of us to say how many of those excess deaths are due to COVID, a broad look at data across the states, which is how one should look at the story, will tell you that there is a larger trend here. Keeping data aberrations aside, there is a larger problem in that mismatch, which will now become a hurdle. If you then start to say, let's give compensation to those who've passed away due to COVID. In fact, Dr. Srinivasan Ramani, would you like to add to this and explain to our viewers a little bit more about these excess death records that, are now being looked at state-wise, and the gaps that there are?
Yeah, so as Danya pointed out, excess deaths is a problem, or rather, undercounting is a problem that pervades various states. I would like to add more to that and say that this is not just an India-centric problem. The WHO, for example, estimated that deaths were undercounted by a multiple of 1.6 in COVID deaths, rather, were undercounted by a multiple of 1.6 in the advanced countries in the Americas and Europe. Now that's those countries in the advanced West, for example, have very robust systems of death registration and certification, and despite that, you see excess deaths being almost 1.6 times more than the official COVID-19 tally. So what we wanted to do was to find out, repeat this similar exercise for various states in the country and find out whether there was a jump in mortality in the pandemic years in comparison to the pre-pandemic years. And we found that there were state-wise variations. So states like Kerala, for example, which has done reasonably, which has had a reasonable response to the COVID-19 pandemic, their undercount we estimated to be 1.6, which is almost the same as what the WHO estimated for Europe and the Americas as of 2020, December 2020. For Tamil Nadu and Karnataka, the figures were close to 6. In fact, in Tamil Nadu, we were able to do a slightly more intricate analysis, and we adjusted those factors for causality and so on, and found that the undercount came down to around 3.7. But in states like Andhra Pradesh and Madhya Pradesh, Scroll had analyzed excess deaths there. We found that the excess deaths were of a multiple of the order of 40 in the case of Madhya Pradesh, 42 to be more precise in Madhya Pradesh, and nearly 33 in the case of Andhra Pradesh. So therefore there are clearly state-wise variations in the number of deaths that have been registered, and at the same time the comparison of those registered deaths versus the actual COVID-19 count. Now, there are some reasons why even in a well-monitored state like a state that monitors COVID-19 cases and deaths, well, there has been an undercount. The reason is, as Danya pointed out, there might be patients who might get admitted to hospitals and could recover out of COVID, but could die of long COVID. Factors that could have resulted in complications after the release from hospitals, and they would be counted as deaths which are not related to COVID. So those are functional reasons that are persistent even in the developed countries. But at the same time, in some states, there has been deliberate, recording, under recording of deaths itself, even though registration of deaths happen, but the classification of those deaths as COVID-19 has been deliberately under recorded. That is what my feeling is when you look at data from what journalists found in excess deaths in Gujarat or in Madhya Pradesh or even Andhra Pradesh for that matter.
Yes, in fact, Dr. Ramani, like you're saying, in a lot of instances, and because we've been relentlessly following this story and various examples that have emerged, in a lot of cases, states don't even recognize a COVID test report. That doesn't get registered. And so if that person, whether at home or in the hospital, then dies of COVID, it obviously doesn't get registered anywhere in the system. This had actually become quite prevalent during the second wave itself, which is why when you look at some of the excess death data that has emerged, Madhya Pradesh, excess deaths 42 times more than the COVID deaths. Andhra Pradesh, 34 times more. I mean, there can't be any other argument to this than to say, Saurav, that some of the deaths were COVID deaths, but you did not register them so. What has your own, deep diving really shown?
So every day I'm getting 50 to 60 letters from all over India, every single day. And the figures that I'm looking at, the death figures, the excess deaths are in thousands because I'm getting district level data from many states. The excess deaths, especially during the second wave, are in thousands. So of course, most of these deaths, one can assume that these are COVID deaths. And recently I had reported on Uttar Pradesh as well. And in Uttar Pradesh, just in 24 districts, I found a 110% increase in deaths compared to pre-pandemic year. And most of these districts had deaths in thousands. Say, for example, Amethi, where there were, I think, almost 20,000 excess deaths. So that is something which is very shocking. And of course, it's related to the pandemic. And most of
let's
these
just break
deaths
it down,
are COVID
Saurav.
deaths.
I'm sorry, I'm just coming at you, but because for our viewers to understand, when you say there were 1,000 or 20,000 excess deaths, what does that mean? Does it mean that the number of people registered as dead in 2020 was, 1/10 of in 2021? Just help us understand what it means.
So if you see UP, the level of death registration in UP is very poor. It's only 63%. Yeah. So that means every 4 deaths out of 10 are uncounted. They go unregistered in UP. So even from those 6 deaths which are actually counted, when you compare it with the pre-pandemic year, and when you see the time period after the first wave, and even before second wave, the excess deaths, the excess deaths in each district has increased many folds. And that is what I mean by excess deaths. It is being seen in many districts. I could only analyze 24 districts, but UP is a huge state, 22 crore population, and it stands at, I think, spot number 5 in India's COVID death toll, with just 23,000 deaths. It is impossible. I mean, it cannot be reasonably presumed that deaths are only in 20,000 or 30,000s. And therefore, the deaths are much more. And just the data from 24 districts for the period before second wave shows at least almost 2 lakh excess deaths. So that's close to what India's official COVID death toll is, which is around 3 lakh something.
Yeah, you're absolutely right. And you say UP has registered only these many deaths. Maharashtra, for example, has been consolidating its death record, as it is called. And on a daily basis, we see 15,000 additional deaths being recorded. Now, this is at the fag end of second wave. So it's not even that actually every day those many people are dying. You are correcting what has happened in the past 6 odd weeks, and you're adding that. Every day for a week, we saw Mahesh Tappa say that Maharashtra was adding 10,000 additional deaths, 15,000 additional deaths. But you would agree that it's still far, far away than from what must be happening on ground. So now, how do you foresee this challenge of giving compensation to families who may have lost somebody to COVID when you don't have consolidated data?
Good evening, Tanvi and all viewers. Let me tell you here that Maharashtra reconciles its COVID death data on a fortnightly basis. So there are cities, there are municipalities which have a real-time updation of the data, and there are far-flung areas like Nandurbar and Naxal affected areas of Vidarbha, in which the data takes some time to come. So we don't have so much connectivity. Nevertheless, whatever is reported, so the death certificate is issued by a doctor. So whenever a municipal council, corporation, or Gram Panchayat is issuing a certificate, the entry into the records for the reason of death is always maintained. On the certificate, it may or may not maintain. I have not seen a COVID death certificate, so I do not know, but I have seen other death certificates. It does not say the reason of death. It generally says it's a death certificate. But whenever the government collects the data, the signing authority, the doctor, whoever is in charge of issuing the death certificate to the patient or the relatives of the patient, will definitely write it's a cardiac arrest or a cancer or old age or whatever might be the reason. In this case, let us say that the reason is corona. So the corona cases have been registered into the government records, that is for sure. It might take a little time for the government to reconcile their data, which is a fact, and we are not shying away or we are not hiding away from the fact. Now coming back to the judgment which Justice Ashok Bhushan and Justice M.R. Shah has given regarding the National Disaster Management Act, they have correctly pointed to section 12 of the act, which says that the national apex body, which is headed by none other than the Prime Minister of India, the national apex body of disaster management, should have some ex-gratia payment which forms the basis of section 12. So this is exactly what was debated. The petitioner had asked for a compensation of 4 lakhs. The government of India said 4 lakh is impossible. The SDRF will run dry if 4 lakhs of compensation is given to every COVID family. So SDR will have no funds for any other disaster. But nevertheless, the section 12 itself is so the justices said that section 12 itself is very self-explanatory. It is not an obligatory, but it is duty of the management authority to make a framework and to quantify the amount. It can be whatever that is reasonable enough, but it is an act, so that act has to be, it's a statute, so the statute has to be respected. This was the whole thing which was going in the Supreme Court. Justice Advocate General also had some reservation or observation, but the court was, I think they are very right in their judgment when they say on a law point that section 12 within the act must be regarded. Now again, the SDRF, the state disaster management, is totally dependent on the national disaster management agency for the funds. Like today in my state of Maharashtra, if you ask me, so we are already, our coffers are going blank. We are asking the central government, please pay us our GST dues, which is almost amounting to 50,000 crore rupees. And still, we don't have any clear-cut answer when that money will come. But tomorrow, if such an act is made and 6 weeks time has been given for the central government to form a policy, and certain quantity of fund is definitely going to be set aside, but then what about the other disease? Like what if somebody dies of some other illness? There can be swine flu, there can be any pandemic which might set in. So all those things have to be looked at in view of the law, because one cannot differentiate between one pandemic and the other. If there's a pandemic and if it's going to hit us nationally or globally, so it might be today it is corona, we don't know what might happen tomorrow.
Right.
So definitely.
No, but are you ready to fund it? Or you are essentially saying that the center needs to give us money for that. For example, right now Maharashtra has 1.2 lakh deaths registered, and you're saying that if we have to give 4 lakh to each of the families, the center needs to give you that money.
No, that is what the petitioners had petitioned for, 4 lakh rupees per family. But imagine if 4 lakh actually had to be given, how would any state, forget the state of Maharashtra, I would say any state within the Union of India, how will any state government pay that kind of a compensation? So court has rightly observed that the National Disaster Management Authority may quantify that amount. Petitioners may have petitioned something, but the government...
Yeah, fair enough. But like for example, and let me take this across to Mr. Mahesh of the BJP. For example, Mr. Mahesh, Bihar is going to be giving 4 lakh as compensation. In fact, when we had big debates about Bihar's reconciliation of data and how, within 2 days the deaths almost doubled and more than that, the response from the Bihar government and their representatives was, well, we want each family that has lost somebody to be duly compensated. We're going to be giving them 4 lakh, which is why we need to do this exercise. I mean, they conveniently forgot the part that the High Court had asked them to do it, but irrespective, the point is there is one state that is giving out that compensation. Should it be the state's onus or should it be the center's onus?
Certainly. I am very proud to say that the only state in the union of this country, we pronounced the announcement of the compensation of 1 lakh for every death of pandemic in this COVID. See, certainly, I had seen all the discussions of my co-panelists. The Karnataka is the only, as a role model to other states of the country. We announced the 1 lakh rupee. See, we have not gone through either the state disaster management or central disaster management. My chief minister is pronounced the 1 lakh rupee COVID compensation for every death of this state. Okay, and still the death audit is going on of the COVID death. I hope some more beneficiaries can take this.
No, so you're saying the state should be able to, but and what would that 1 lakh is the appropriate amount, because the center will now decide this policy. It's not just to individual state governments anymore.
Yeah, certainly. The whole thing is the health is the state subject. The union government is relentlessly work to combat with the COVID, and the state also the cooperate with the union government.
Okay, let me bring in Saravanan as well. Mr. Saravanan, where does your party and the government stand? And because while the intent is right and what the Supreme Court has said will have to be put in place now, I'm just hoping it doesn't become another state versus center battle.
The act is very, very clear. It says the national authority shall recommend, and it is also, the previous section says, the national appropriate provisions shall be made by the central government for financing the measures to be carried out under the national plan. So the onus is on the union government to provide this relief, because the Disaster Management Act, the entire country comes under the control of the union government. So that should be, and of course, with the advent of the GST, the state's share of revenues have dipped, and it will open up a Pandora's box if we go into the debate of whether the state should bear this cost. It will be prudent. It will be good, because the central government has already allocated 35,000 crores for vaccines, and they have spent only around 4,500 or 5,000 crores for the vaccines so far. And we don't know yet how much is going to be spent on the vaccines. Until then, probably this could be drawn out from that fund and given to all the persons. And when it comes to this death, in Tamil Nadu, when our chief minister, when the DMK took power, in the first meeting of the district collectors, the first diktat that was given to all of them, or a request that was given to all of them, was that please don't hide anything. That was the request given to all the district authorities when Chief Minister Mr. M.K. Stalin took charge. And we are going by that. So we will also be able to reconcile everything and arrive at the right figure.
Yes, well, wherever it's happening, in most states, I will say, is because there has been some kind of a court intervention. But should we not make it simpler, Dhanya, and say perhaps there needs to be a national audit to get us a little closer to what the ground reality may be. And now I'm not just saying for the fact that there is a compensation angle involved, but for us to know what has been the loss, for us to design our policies, for us to prepare better for future, we need to know what the loss has been.
Tanvi,
Mr. Saravanan, just 1 minute. Let me take that question to Dhanya Rajendran. Yes.
Tanvi, first, I don't think that too many states have proper audit committees or reconciliation committees. Only very few states have. In fact, I think Maharashtra, Bihar, Kerala, for example, has a monthly audit committee report where they reconcile debt. Tamil Nadu had spoken about an audit committee, but I don't know if that committee is publishing reports. Karnataka also in that case. The problem here really is that I don't understand why these states think that they can hide data. We are talking about debt here. And no matter what you show as the cause of the debt, people are going to apply for death certificates. At least a large number of people in India will apply for death certificates. And by the end of this year, we will have the civil registration system report for last year. By 2022, we are going to know how many people died in 2021 in India. And when we calculate the excess death, which is when we compare the number of deaths between a pre-pandemic year and a pandemic year like 2021, we are going to easily know how many excess deaths India has had and how many excess deaths each state has had. So all these states which are trying to hide data now are going to have eggs on their faces in a matter of a year's time when death registration reports come out, because these are annual reports which are compiled and which are published. So there's no way they can hide all this. So why are they even making that effort? The last thing I want to point out is we are talking about compensation to 4 lakh people who have died of COVID, I mean, recognized of dying of COVID, and many others who are not in the list. But imagine that last year it was promised Pradhan Mantri Garib Yojana that there would be money given to doctors, to ASHA workers, to frontline workers. How many of these people have got? The IMA has written letter after letter to the union government saying that doctors who have died of COVID have not got compensation. ASHA workers in many states, if 20 have died, only 1 or 2 ASHA workers' family in a state have got compensation. How are we even going to process lakhs and lakhs of requests when it comes in? So the governments have to be quicker in even giving compensation. Who are you trying to help here? And when will you help these families?
It is because, Dr. Ramani, maybe you can come in on this as well. The answer lies in the fact that for most governments, it's headline management. To announce a compensation even before you look at fixing the problem or finding out what the problem is, headline management. To then look at the deaths data and say only these many have died and not 4 times that or 40 times that is headline management. Gradually, over a period of time, they may correct it a little bit. But by then, they are hoping that people have forgotten about it.
Fair point. The other thing is that, this hurts, this data hiding business hurts integrity of data, and hurting the integrity of data, affects our COVID response, right? If you only if you know, yeah, if you know the extent of deaths and the age group of people who are dying and the comorbidities that they suffer from that leads to the deaths, only then you can plan your response better. No, we know that close to only 4 to 4.5% of our estimated population has been vaccinated with 2 doses so far. So it's not a matter of if anymore, it's a matter of when the third wave hits us, it would be prudent of governments to identify zones, identify areas where they think the mortality could be high. There are some studies already which show that the areas that were affected in the first wave were badly affected in the second wave as well. So, I mean, if you have proper data, only then you can come up with clear planning as to how to, tackle the COVID problem if another wave hits. And that's why I don't understand why deaths should be hidden. Just to add to one more point that Danya mentioned, yes, we will come to know the extent of overall mortality in a year's time. But again, the civil registration system is not uniform entirely in the country. Now, as Saurav pointed out, just 60% of deaths are registered in UP. The number in Bihar went up from something around 35 in 2018 to around 53% in 2019. So, and there are other problems such as, state like Chhattisgarh, the records are maintained offline, but registration of deaths online is, not that high. So there are interstate variations. So even if we get to know what the extent of mortality is, it won't be at the same moment for each state. So some days it will be even further delayed. So first of all, this pandemic, offers us certain opportunities to gear up for governments to gear up their civil registration systems, make it more robust, make online systems more robust, so that they will know at real time what is the extent of deaths that are happening because of this public emergency that all Indians have faced and virtually the world has faced. So I think they should use this as an opportunity to not hide this, but to be as transparent as possible. As Mr. Saravanan said, that is the only way for us to tackle this pandemic better. And as WHO, the chief scientist Soumya Swaminathan said, data is key to tackling this pandemic. And that mantra, if every government follows, especially the national government, and they don't make it into a headline issue of trying to show lower deaths in order to show that their response is better, that is not the way to tackle a pandemic. Ultimately, it will only affect. I'll say it frankly. a state like Telangana, for example, we couldn't get data district-wise for Telangana for deaths in Telangana, while we get district-wise data almost for every other state in the country. Now, Telangana is not a backward state per se. At the same time, we got data from the Greater Hyderabad Municipal Corporation, and we found that the excess deaths in only Hyderabad was almost 10 times more than the excess the COVID-19 tally in Telangana itself. Now, what is the Telangana government trying to do by hiding these deaths? I mean, it clearly, it clearly affects.
I will not go into specific names, but suffice to say there are few states in our country today who have massive information black holes when it comes to COVID data, from testing to number of cases to deaths. And then there are few states in our country who are adept at denying the data. Whatever you throw at them, they say no. So there are all kinds of these, and the politicians continue to tell us, no, all of this is unintentional. We are doing our best to give you the truth. Danya, you wanted to comment before I go across to Mahesh on it?
One quick line I want to add to what Srinivasan said. Telangana, for example, the lengths to which they go is ridiculous. For example, the civil registration system website of Telangana has got the data of all the districts, but they've removed Hyderabad from that data because they don't want that data out there. So if you check every village, panchayat, municipality corporation is there, only GHMC has been removed from that website.
That is the extent to which states will go to not give you real data. Mr. Mahesh Tapase, as the NDMA comes back with guidelines to the Supreme Court, do you think a part of it also has to be a nationwide audit of what the true picture is?
I totally agree with what you said, Tanvi. An audit is definitely important because we're a country with a huge population and with a migratory population. So people from, cities like Mumbai, Delhi have a population which is coming from other states of India, and who knows, I mean, they may not see the dawn in their own native places. So that's another probability. So somebody who's who's born in Bihar and working in Delhi, or somebody who's born in UP and working in Mumbai and gets the pandemic and dies because of pandemic. I mean, how do you justify his death? Who gives the certificate? And because people would want to carry the body back home. I mean, for other illnesses they would, but now not for this, I'm sure. But again, then who will give the compensation? Whether UP will give, Bihar will give, Maharashtra will give, Delhi will give. So this issue, I'm sure, will come up in time to come, and nobody other than the National Disaster Management Authority is the rightful authority to frame the law regarding the same. I would thank the Honorable Supreme Court that they have made the authority aware of their constitutional rights as far as enshrined in the Section 12 of the Act. And we all, because now this is going to be a big thing, because now here the Supreme Court has given direction, the central government has no option but to make a directive of this and issue the same directive to the state governments. And once it is on the state government, then you can just imagine what's going to happen. So the quantum of compensation has to be decided, and after being decided, it has to be budgeted. I mean, it has to be there in the treasury of the SDRF or NDRF, whoever is going to pay that money. It has to be in the treasury. You can't make an announcement and then not pay up the ex-gratia payment, because we have so many natural calamities happening in our country, whether it's the Tokte cyclone in Maharashtra, Gujarat, Goa, or something that happened in Odisha recently. So we have too many natural disasters happening. We have pandemic. We have so many other things.
Yeah, and every time, let me just say this. I know what you're trying to say, and you're saying that, then where do you draw the line and how do you fund all of this if you have to give compensation everywhere? But let's also keep in mind, even the ones that are announced, like Dhanya was pointing out, barely a percentage of them actually are paid to the people who rightly deserve them. That's also the unfortunate truth in our country, that you announce these large-scale compensations and schemes, but people who are rightly should be getting that money as a support don't even end up getting that money. So, Sarvanan, how do we go about it? Because these guidelines have to be framed. Who pays for it? Should there be a national audit? Who handles it? Who ensures that the right people get it?
Yeah, see, certainly there should be a national audit, because most of the states, they take the defense that we are merely following the ICMR guidelines. We are not recording deaths because it is because of a comorbidity, because this is what ICMR has told. So a national audit.
But the ICMR has repeatedly now said, Sarvana, in the last many months, often they have said that no, we are very clear, you must count even comorbidity deaths as COVID deaths.
Yeah, but that is the difference taken by everybody. Even the Gujarat Chief Minister, Mr. Vijay Rupani, takes shelter under the ICMR guidelines. So a national audit is a welcome thing. If this union government is going to come and say this is how we are going to record deaths, and definitely the difference between the previous year's death and the 2020-21 deaths will give us the exact amount of excess deaths. And so many people are trying to do that, as pointed out by Danya. And when it coming to this question of who's going to fund this, I think who is going to frame these guidelines? Of course, it should be the union government that should fund it, and they should go along with the state government. They should go ahead and ensure to who are all the persons who will be eligible. When you have not found out whether this a person XYZ is dead because of COVID or not, how is the relief is going to be granted? On what basis this relief is going to be granted? I think that will be a big problematic area.
So irrespective of what the center says or doesn't say, shouldn't your state already be doing that? Are you conducting such an audit and reconciling your data? You did it after the first wave.
Yeah, see, that's what, see, in 2020, as per the other reports, there were excess deaths. In 2021 also, they are saying there are excess deaths in Tamil Nadu. And definitely the state government will go by that, because we raised this issue. When the deaths were not reported properly, as an opposition party in 2020, we raised it. Now we have come to power, we will definitely do it. Do the audit and ensure that the right figure comes out. And the relief measures that has to be given. Yet another important aspect is that all the other countries in the world, they have given compensation ranging of $1,000 per month or so. But the union government so far has not given any compensation to the common man. Probably they should take this up, take this relief measure as pointed out, as mandated by the Supreme Court. The union government wanted to slip away, wanted to not to give this compensation, this relief measure. They said, please read down shall.
Yeah, okay.
The act says shall.
So let me ask Mahesh if he wants to come in here, Mr. Mahesh, because at the end of the day, the BJP as the union government did take this stand in the center, saying we can't give compensation to everybody.
See, in the sense of the pandemic 1 and pandemic 2, the BJP, the Modi will take all the measures to combat with this COVID. And what are the things to do for the all the citizens of the country? The Modi ji has done very well. They provided all the Garib Kalyan Yojana. They provide food. They provide vaccine, free vaccine. What are the medical things they have to be taken? They have taken everything in the stock. The thing is the only Karnataka government has initiated the process to give the compensation. I hope the rest of the states of the country, they will take this footprint and they do their, instead of doing all wrong gimmicks on give small cheap popularity schemes, instead of to do for the give compensation to those who are the victims.
Okay, Saurav wanted to make a point earlier. Let me just go back to him.
Yeah, so I wanted to say that when such large-scale fudging of data is happening in many states, it feeds into our public policy, and it seriously hampers how seriously people take this disease. When they see such low mortality rates from COVID, it affects their mindset, and people take it lightly. And therefore, this is a concern not only highlighted by us, but also Dr. Randeep Guleria, director of AIMS, when in an interview to the NDTV, he even called for a death audit in each state, seeing that excess death figures are coming out. At that time, Madhya Pradesh figures had come out. So this is a huge concern also. And on the data black hole that we are talking about, like in the state of UP, it was difficult to get out the data. But even in the central government, data black holes are being created. You see, there was a huge mismanagement of oxygen. What happened? There was a committee in place. There was a task force in place. Where are the minutes? Where are the data? What work did it do before the second wave? All that data is not being provided. You see vaccine-related data. It has not been provided. Everything has been denied under national interest, saying it is going to harm India's national interest. So a data black hole is also being created in the center along with the states. And this will ultimately hamper our public policy and how seriously people take this disease. That is the point I wanted to keep, because transparency, even in death audits, transparency is most necessary, because only of transparency we came to know about these excess deaths. Without transparency, we won't be able to plan accordingly for the upcoming waves.
So the excess deaths data, like we pointed out earlier as well, for example, sort of in different states, different reports have emerged. Madhya Pradesh is 42 more times than what the COVID death shows. Obviously, it doesn't mean exactly that the COVID deaths would be 42 times higher than the official data. Some of them may have died due to other causes. But Andhra Pradesh, 34 times. Assam, 31 times. Excess deaths are 31 times more than the COVID deaths. Tamil Nadu, 7.5 times more than COVID deaths. Karnataka, 4.8 times more than COVID deaths. Kerala, 1.6 times. Uttar Pradesh, 43 times more than the COVID deaths. Now, and I speak specifically of, states like Uttar Pradesh and Madhya Pradesh, where it's significantly higher, because there are a lot of ground reality issues as well. I mean, a lot of people are probably not even realizing what caused this death. They are not registering it in the local office. The bodies are not even being taken to a crematorium, are being buried next to the riverbed, and then are later on emerging in the river. So just to take our viewers through the details of these kind of factors, which are probably also not getting counted at all.
Right. So like in states in UP and Bihar, the registration of deaths are anyways very low. In India, 60 to 65% of the deaths are at home. So home deaths are there in a significant portion, 60 to 65%. And in India, only 20% of the deaths are medically certified. So even after this Supreme Court judgment, what about the deaths that have happened before this time period, in the first wave and second wave? So there are many ground realities like that. In many districts in UP, the civil registration system is very poor. In states like UP, Bihar, Madhya Pradesh, district-wise, there is a lot of difference in deaths, in excess deaths as well. Even in the underreporting factor, figures vary anywhere between 5 to 300 times than what is reported by the state. So district-wise also, there's a lot of difference, and that is why I think it is very important that the state itself comes out in a transparent manner with this data, so that victims are appropriately compensated, and also that we plan for the upcoming waves in a better manner.
For example, Danya, let's talk about Karnataka, where also you guys did quite a bit of work even before the excess data numbers came out, when you went around the crematoriums consolidating the numbers for cities like Bengaluru, and there was a massive mismatch with what BBMP was saying. What was the response of the authorities? Every time you highlighted the massive mismatch, what has been the response?
Well, in Bengaluru, for example, when I had done a story, I'd gone to 7 to 8 crematoriums and counted from the register. As in, I counted the deaths in April and till the mid of May, I think, when I did the story. When I told the BBMP that, look, there is definitely a mismatch. For example, if you are counting 300 deaths, anything to 800 has happened that particular day. So why is that a mismatch? So what the BBMP told me then is that, like Saurav said, many are home deaths. And even COVID, many are home deaths. People were not getting hospitalized. Their health would deteriorate very fast. And even before they could get hospitalized because of shortage of beds in hospitals, they were simply dying in their homes. Now, what was happening is that these dead bodies were taken to crematoriums in private ambulances. So most of the deaths which BBMP, GHMC, or Greater Chennai Corporation, whatever, that they consolidate are mainly from hospitals. So whatever death hospitals record, that immediately reflect in the government bulletins, but there was no way to keep record of home deaths. BBMP had told me at that time that they have a new system where all private ambulances have to register, and every dead body taken to a crematorium was taken into account. I'm not sure if that system is really in place. We'll have to do a check again. But home deaths clearly is a huge black hole, which is the data which states are not even interested in looking into, because then the numbers of COVID deaths would get really inflated.
Yes, absolutely. In fact,
and just to
yeah, go ahead.
And just to add here, when this story on UP came out, the UP government hasn't responded officially till date. However, through whatever media bites we have seen, the spokesperson of the UP government come out and tell us that you have to go to every district magistrate and ask them why there's a mismatch. So when credit is to be claimed in this fight against pandemic, it all goes to the state government. But when such figures come out of excess deaths, of data fudging, we need to go district-wise to each and every district magistrate to ask them why there is a mismatch in data. So again, there is no responsibility. Nobody is taking responsibility here. And the state has disowned its COVID dead victims by not even counting them. So there is no justice here.
And isn't that concerning, Mr. Mahesh, for any government and party to respond where you don't even want to know what is the extent of loss that has happened?
Tanya, there is no any intention to hide the death rate. See, India is not a China. India is the democratic dispensation. So we have every death has to be audited. There is any COVID protocol, they should have to follow the COVID protocol. The death of what are the death is happened, it is in the purview of the COVID death. The only thing is, we come to know that after the death audit it comes out, the every truth will be come out. There is no hide or any intention to do the government and deliberately.
Can I just say something here?
Yes, go ahead, please. Yes.
Yeah. So let us take the examples of Jharkhand and Kerala here. Now, Jharkhand has now, and even Rajasthan, Jharkhand has now commissioned, audit where they're going to door to door and trying to find out what is the real extent of the deaths. In Rajasthan, the Rajasthan government, after some pressure, has also agreed to a death audit, and they are actually in the process of actually collecting information in this regard. In Kerala, for example, even though the state had, the state is a complete anomaly in the sense that we found that there were excess deaths in 2020 also in several states, but in Kerala there was a decrease in deaths because of the more robust primary healthcare system. Some deaths that could have expected to occur did not occur because of this surveillance. Perhaps there were no road accidents because of the lockdown and so on. Now, even in a state like that, after some pressure from the opposition and from civil society that some deaths were not being counted in the second wave, they changed the process, and they, instead of having a state level audit committee, now they have health experts in every district, reporting deaths in real time. So these are examples of proactive steps taken by states in order to come up with clear data and to show that their data integrity is fine. On the other hand, in some states, the truth is coming out from the river Ganga, if I can put it that way. Now, these are the variances that are happening state by state. So therefore, yes, first of all, our central government should shed complacency. We keep talking about excess deaths now, but the extent of the excess deaths is so high. Why is that the case? That's because we never expected the second wave to be this virulent. And one of the reasons this happened was because the government simply thought that they had conquered COVID. And no preparation was made in states where the health infrastructure is very poor, especially in the northern states such as UP and Bihar, where rural health infrastructure is almost non-existent in many districts. That's the reason for all these deaths that have happened. So first they have to shed complacency. They might think that the second wave has, now that vaccination has begun, the worst is over. No, we don't know if the worst is over. The worst can still happen later. First of all, they have to shed complacency. Secondly, they have to be true to data. And only if they are true to data and they believe in data integrity will they be able to tackle the pandemic better.
Oh, you're absolutely right. And which is why
The thing is the crisis is nobody is predicted and nobody is expected.
No.
This is the collective
Mr. Mahesh, I have let go. 1 minute, please. Allow me. Because you're going to make these ridiculous claims once again, I have not countered 2 of your past claims as well on this, where you say nobody wants to hide anything. We are not intentionally trying to hide. Governments are. State after state, again and again, with example after example, have been shown how they were misleading us with data. And like Saurav pointed out, not just deaths data, Mr. Mahesh, when it comes to testing data. 1 minute, please. 1 minute, please. Now allow me to finish, because I have heard these excuses far too many times. COVID deaths, testing numbers, total cases, vaccination estimates, vaccine supply projections, everywhere you mislead us with data. You just don't want us to acknowledge the actual state of affairs. Court after court, from Karnataka High Court to Bombay High Court to Gujarat High Court, Tamil Nadu, Andhra Pradesh, Telangana, West Bengal, court after courts have asked the government what is the true picture in the terms of number of people dying. So either you all, Mr. Mahesh, do not care to find out how many are dead, or you intentionally don't want to tell us how many of are dead. Now you tell me which one is it.
No, madam, I have made it very clear myself. This is not the time to tu my me.
This is not tu me. This is us making you accountable. This is not tu me. There is no other opposition party here.
No, it is the responsibility of the state. We should work together to defeat the pandemic.
But according to
each other, we should not transfer our responsibility for the only union government.
That doesn't mean you mislead us, Mr. Mahesh, to say that nobody knew that there would be a second wave. Mr. Mahesh, to say that nobody knew there would be a second wave, that it would be so unprecedented is false.
Intentionally,
the technical advisory committee in Karnataka has gone on record multiple times saying that they had predicted a severe second wave, but the Karnataka government did not do enough to really increase capacity. This has been said by the technical advisory committee members many times on record. So what is Mr. Mahesh talking about? That we did not expect this kind of a second wave. Of course, maybe not at this level, but were preparations done even at a moderate level is the question.
No, you didn't even act when numbers started going up. In the month of February, we were showing numbers as saying numbers are going up. No state government wanted to act about that until the month of April, when things went out of control. Obviously, you will see an unprecedented situation, Mr. Mahesh, because you didn't act when you were supposed to.
See, the thing is, we third world countries, we did such a medical facility, we provide all the things no other developed countries has done. See, one should have to think. See, what happened is, suppose if it's 30 years, 20 years back it is done. See, we have taken everything, every measures, all the measures the government has to taken, it is taken very seriously. Who gave the report that the second wave will become? Where it is that report? Show me.
I think Mr. Mahesh has still missed the report that the technical advisory committee gave, or a series of experts sitting on every channel writing reports after reports, writing for all newspapers and digital websites, were constantly talking about second wave. Even if you didn't want to listen to your own experts, Mr. Mahesh, let's just make it clear, every other country had already gone through a second wave. And India would not have been any different because we didn't have any magic wand. Completely out of time, but last comment to Saurav before we wrap this up. Yeah, Saurav.
Just to add here, if the government was so prepared, why are the workings of the important committees that it has, task force, the National Task Force, the NTAGI, the Joint Monitoring Group, why are the workings of those committees in a sealed cover by the government? Everything has been hidden. So we don't know what work has been done. We don't know what the members have discussed because they have made them sign a confidentiality agreement. So we don't know what inputs were given by a lot of other members. And all this is never coming out in the public.
Yes,
so the government,
because tomorrow when you fail, Saurav, tomorrow when the government fails or when things get out of hand again, it will be very easy to say experts missed the bus. Even today, there are people who are questioning the experts for failing to flag it off to the governments because the experts can't come out and tell you what were the conversations and what time did they, highlight it to the government. But there are examples. And journalists who are on this panel know this. There are examples of specific states and specific districts who did listen to the experts, who did act a little bit better, a little bit more on time to try and minimize the damage of second wave, who are already right now, as we speak, working so that the next time around things are not so bad. You can only do that. You can only learn your lessons from the first wave and the second wave if you have correct data with you. You can only plan for the next wave. You can only plan what healthcare infrastructure you need, the extent of challenge that you may stare at, if you have correct information about what has happened in the last wave. If you don't know how many were infected, if you don't know how many actually died because of COVID, then you don't know just how bad the state of affairs was, then you don't know just how much of healthcare infrastructure needs to be built. Which is why, more than anything else, which is why it is important to have real picture and correct data. If you don't want to acknowledge it even publicly, at least know it internally and prepare better for next time. Thank you for joining us.